All right, it may be something that you think about for yourself or maybe perhaps a parent. We are talking about falls, and they happen all the time, especially the older you get. They can be dangerous, even deadly, but the good news is they can be prevented. You might be wondering how. Well, Dr. Arbaje from Johns Hopkins is here to tell us. Thanks for being here. Good morning.
Thank you for having me.
Always good to see you. How serious is something like this?
So people don't think of falls as being very serious. They think, oh, well, I just tripped over something. That's not a big deal. But in an older person, falls are very serious. 1 out of 3 older adults falls every year. And if you're over the age of 75, 1 out of 2 people fall. Falls are the leading cause of death for older adults, so it's from injury at least. So it's really important to pay attention to falls because usually falls are a sign of something else being a problem. So people might wonder what makes them at risk for falls and what causes them. It's really important to think about that falls are rarely from one problem. It's usually a sign of other things going on. There's usually 2 or 3 things that are happening.
What's happening then?
So most importantly, medications. Side effects from medications can be a big problem. So if you're on 4 or more medications, you're more likely to fall, especially if those medications are blood pressure medications, sleeping medications, all sorts of things like that. And then medical problems can also make you more likely to fall, like Parkinson's, Alzheimer's disease we heard about a little bit earlier today. And then dizziness, weakness, those types of things. But also, people forget the environmental hazards at home. Most people fall at home. That can be a problem. So slippery floors, poor lighting, that sort of thing.
When it comes to something like this, I imagine the severity is much more, a broken bone is harder to heal in an elderly person.
That's definitely true. It can take a long time, and it can lead to further complications that are beyond the broken bone. So other things that falls can lead to are infections. They can lead you to being immobile, which has all sorts of other consequences, and then head traumas as well.
What about the preventative aspect? Because if there is something that you can do about this, you probably should be doing it now.
Absolutely. So the most important thing is to report a fall. Don't just think, oh, I just fell one time, it's not a big deal. If you're an older person, report it to your primary care provider so that you can have a falls checkup. And what's a falls checkup? Well, you would go and the doctor would look at your medications and see if any of them are leading to side effects that can make you more likely to fall. And then they'll also check your balance and your gait, watch you walk, and check the strength in your legs. But things that you can do, make sure your vitamin D levels are normal. Vitamin D is such an important hormone. It's actually a hormone, not a vitamin. And it's so important. When people have low vitamin D levels, they're more likely to fall and to break bones afterwards. Other things you can do are train yourself to have better balance, so things like yoga, tai chi, and seniors can do this. It doesn't have to be very advanced, but things that really help you with your balance.
It's a hard one, too, because I think a lot of people think this isn't going to happen to me, and if it does, it's more situational. You know, you mentioned medications or your health, but I think a lot of people don't think that it's going to be one of those reasons that causes them to fall. So if they're worried about it, where do they go from here?
So the first thing to do is first talk to your primary care doctor or other doctor. You can also see a geriatrician. We have geriatricians all around Baltimore area. We have them at Bayview, and have them evaluate you. But also a physical or occupational therapist can evaluate you to see what your balance is like. And then getting the clutter out of your home, making some changes in the home environment, a therapist can help you with that as well.
Okay, Dr. Arbaje, thank you so much for coming in from Johns Hopkins. Justin.